Welcome to this introduction to free flap monitoring, which is a part of a series of presentations and videos on free flap care for nursing and staff. In this presentation, I will provide a brief overview of methods for monitoring free flaps after surgery. More detailed information on each method will be available in subsequent presentations and videos. In a previous presentation titled, "What is a free flap?" we discussed the details of a free flap microsurgery and the importance of flap blood flow or perfusion to keep the flap alive. Since free flaps get their blood flow from only one artery and one or two veins, it's very important to make sure nothing interferes with blood flow, which could lead to loss of the flap. Problems with free flap perfusion can be caused by internal and external factors. Internal factors like formation of blood clots in the flap vessels and excessive swelling due to fluid intake or positioning can obstruct blood flow into or out of the flap. External factors like pressure on the flap and positioning can obstruct blood flow into or out of the flap. After surgery, the free flap is closely monitored for problems with blood flow through a variety of techniques and monitoring methods. We have a variety of techniques and technology that can be used for assessment of free flap perfusion. Each of these provides different information on blood flow to the flap. These monitoring methods may be used in various combinations based upon the type of flap and its anatomic location. After surgery is finished, here's what you might see when the patient arrives to their hospital room. At first, it may seem like there's a lot going on here, but let's break it down. First, you want to make sure to do a clinical evaluation of the flap, noting subtle things like color, capillary refill, flap temperature, flap turgor, or swelling. In order to monitor blood flow, there are various methods of monitoring, each giving different types of information to assess flap perfusion. A blue suture may be placed on the flap during surgery, marking the perforator signal. This is where we do post-op flap Doppler checks with a handheld acoustic Doppler. A silver venous flow coupler wire can be seen emerging from the flap, which connects to the venous flow coupler black box for audible monitoring of venous blood outflow from the flap. A white Vioptics probe cable, which is connected to the Vioptics monitor, provides real-time remote monitoring of flap tissue perfusion and oxygenation. There may also be Penrose drains and or JP drains to prevent fluid buildup beneath the flap, which could compromise blood flow. First, let's briefly talk about the handheld Doppler. The handheld Doppler allows us to intermittently monitor blood flow to the free flap, but may take some practice to learn how to locate the correct signal. The location of the perforator, where the best Doppler signal or pulse can be found, is marked during surgery with a blue suture in the middle of the flap, so it can easily be found for monitoring after surgery. This blue suture marks the area where you should use the handheld acoustic Doppler to perform your Doppler checks. Now let's talk about clinical flap evaluation. Clinical flap evaluation of free flaps by physical exam findings can identify signs of change in flap perfusion, such as changes in flap color, capillary refill, temperature, and turgor or swelling. Clinical flap evaluation is one of the more traditional methods of free flap monitoring, but is subject to human error and requires significant experience for accuracy. Now let's talk about the venous flow coupler. In some cases, a small Doppler probe may be attached to the coupler on the flap vein, providing an audible signal of vein outflow for monitoring after surgery. The venous flow coupler allows us to continuously monitor venous blood flow out of the free flap. This is seen as a silver wire connected to a thin white cable, which is then attached to the venous flow coupler black box for audible monitoring. Next, let's talk about the Vioptics tissue oximetry monitor. A Vioptics tissue oximetry probe attached to a thick white cable is placed on the flap during surgery. This cable is connected to the Vioptics monitor, which provides continuous monitoring of flap tissue perfusion and oxygenation. This technology uses near-infrared spectroscopy to provide continuous real-time monitoring, which can be remotely monitored by the surgeon. This is a very sensitive technology, but may provide some of the earliest clues to impaired flap perfusion, thus improving survival. Parameters and thresholds for flap oxygenation, which trigger an alarm, are usually set by the surgeon. Intermittent methods of flap monitoring, such as Doppler checks and clinical evaluation, are performed more frequently initially after surgery when the flap is at greater risk for problems with blood flow. Then the frequency of this monitoring typically decreases over time. Continuous methods of flap monitoring, such as venous flow coupler and tissue oximetry monitors, remain connected throughout the hospital admission. Thank you for watching this introduction to free flap monitoring. Please stay tuned and follow for more presentations and videos on free flap monitoring and care after surgery. More detailed information on each method will be available in subsequent presentations and videos.